Get started with the class today. Okay, guys. I'm a little sick and I'm a little tired and exhausted, but guess what? There's no excuses when it comes to working hard. I have BPPV. BPPV. It's like if I move my head, I'm like vertigo. So now I know what BPPV is. Like it's actually happening to me. That's so funny. Anyway, and it's fun to self-diagnose yourself. I love how we don't need to go to the hospital to get diagnosed. You know what I'm saying? So like instantly when it happens, you know that, oh, this is this, and this is all I need to do for it. So that's fun being a doctor. It's a unique profession. No one, absolutely no one. We're trying to be happy for being a doctor. Just kidding. See, if you're in a profession, I believe that once you're in something, then don't complain about it. Rather, just look for the good things about it. I've seen many people complain. If they're a doctor, they complain. I assure you, even if they were like in the best profession, they'll still complain. So that's the problem with the psychology, the personality. Okay, so what you think of something, how you perceive something, that's your problem. If you look at the positives, you're always going to be happy. If you're always going to look for the negatives, then there's going to be problems. I hope everyone's doing good today. So, guys, today is like the second last class, not second class. Thank God, it's the second last class, and you guys have come far. Well done. The next will be our surgery class, which will be on this Thursday. And then we will be like relaxing. Not, I will be relaxing, you guys will be studying. But it's going to be fun because this was the first part, right? So now you know exactly what this exam is. Now you know you've been through all the topics. That's what I love, that you've had a overview of all the topics. So that is beautiful because that's the part where it does get a little difficult because there's some topics where you don't even want to look at them, and then however, but you've come this far and you've done those. So today's class is just counseling, right? So most likely we'll end quick. It's not that a long topic, so that's the good news. Okay, so we are learning the art of conversation. Maybe my energy won't be too high because the more I move my head, I'm vertigoing, right? So I'm gonna take it easy. Okay, I needed that water. Okay, hi, everyone needs to be active. Let's take it to the chat. Next to you, this whole time I was talking to myself. No, Arshi's here. Yay. The mute Arshi is here. Yes. Love it. Love it. Zara's here. Thank you guys for being so active today. And the guys that are not active today, I'm just gonna kick them out. Give me a second. I said, Assalamu alaikum. Walaikum assalam, bro. Bro, did I just call you bro? I'm so sorry. You're a gynecologist. How can I call you bro? I'm sorry. So, what I'm trying to say is that, okay, guys, well done. Thank you for replying. Whoever did not reply, I'm about to kick them out of the room. I'm so rude. Okay, it's time to remove from meeting. Okay, Seher's here. Finally. That's what took for Seher to respond, right? Well done, guys. So, Arshi, Zara, Aisha. I guess we have 4 heads. That's good enough. Let's learn the art of convincing someone. Okay. So, counseling is all about, now you'll see counseling in your notes and you'll be like, what is this topic? So, counseling is this topic where there's going to be different scenarios. There's no structure to counseling. Every scenario is going to have its own structure. I'll tell you how. But all you have to do is stick to your baseline structure. Stick to the basics that I taught you, which is that basics are when you don't know what to do, just lean back and just fall to the structure that I taught you in the first place. This guy right here. Okay, so whenever you don't know what to do, PMAF TOSA. Idea, special questions. Explain, diagnosis, now go for do I need to investigate? If not, okay. Treatment, concerns, counsel. So every time it's going to be the same. So that's the beauty of this exam. And I just want you all to know that enjoy this exam because this is a fun exam. Like the most fun exam and the most like unpredictable exam in my life. Like it was the most difficult, I'd also say, because it's a new country, a new place, a new type of exam. You've never given an exam where you have to actually diagnose on the spot. Very different exam, but honestly, it was the fun, the journey of memorizing, the journey of learning, the journey of studying for this exam is so much fun. I don't know why, but it's just so much fun. You meet all these new people and then you like learn different cultures. If you're into that, then you'll enjoy it. If you're into like learning about new culture, meeting new people, and learning how to like exposing yourself to new things. If you're not very good with new things, you might not enjoy it that much. Anyway, so the scene is that in counseling we'll have many scenarios. So one of those scenarios in counseling is epilepsy, but we've already discussed epilepsy. So epilepsy was also basically a counseling scenario where you were supposed to counsel them about not to drive, their profession, and they're not supposed to be swimming, they're not supposed to be dancing, and all of those things. That was to a counseling scenario. Basically, whenever counseling scenarios can also be in your regular scenarios. So it could just be a counseling of the fact that she is too sick and she has a heart condition. You have to counsel her on eating good, eating healthy. So whenever it's something convincing someone to do something in their life, to make a change in their life, that's when you do counseling. Okay, so let's talk about the first simple case. The first case of counseling that's coming nowadays in PLAB 2 also is the alendronate counseling. Okay, so this is how the case will present. You're an FY2 in the GP surgery. Diana Smith, I'm just gonna like turn off my video so that you guys don't see how miserable I am. uh, So FY2 in the GP surgery, Diana Smith is a 62-year-old, had a fall, fractured her hip 3 months ago, for which she was successfully treated. DEXA scan was done, showed osteoporosis. Talk to patient, explain medication, alendronate. This is a counseling scenario. What does counseling scenario means? When any scenario hasn't fitted into any other topic, they usually throw it in counseling. And mostly counseling is when you have to explain something, when you have to elaborate on something, when you have to talk about something, like give her a speech either in convincing form, either in telling her about a medication, telling her about a new therapy, telling her about lifestyle modification. All of these things come in counseling. Okay. Now let me tell you what students, kids struggle with in counseling. The biggest concern of people in counseling that I have seen in my experience is how to ask questions. So just let me connect my writing notepad so I can tell you how to ask questions. So what did I tell you guys? We always start with the OD para complaint. Now let's see. FY2 in the GP, Diana is 60, had a fall 3 months ago. The DEXA scan was done. This is too much information. What am I supposed to be talking to her about? Fine, probably. What do you guys think you should, what are the main points of discussion here? What do you guys think?
We need to explore the fall first.
Brilliant. Okay, good. Aisha has something to say.
Um, uh, as she said, we have to explore the fall and the other things like osteoporosis.
Very good.
Yeah, and
Osteoporosis really. So guys, remember, whenever there is such a huge scenario, there's so many things to explore. Always underline at least three things maximum. Okay. So let's underline. Wow, why are you so thick? Okay, 1 second. So first thing, fall. I know that guys, remember, whenever we start, if you even fall back to the structure I taught you guys, the first part was always about complaint. So if you notice that this is kind of like a complaint, let's explore about this a little bit. But once again, I'm going to keep coming back to this point. And the point is, honey, where is it, the point? Oh my God, there it is. Keep history short. Keep history short. Keep history short. Counseling cases, they are going to require you to speak a lot in management part. There's a lot of things you need to, a lot of points you need to cover in management. That's why keep your history short. So guys, whenever you are going towards the ethical stations, all the ethical stations will have one basic rule: kindly keep the history shorter and management longer. So if previously we were doing 3 minute 30-second history and 4 minute management, this time do 3 minute history and 4:30 management. Or even if you can take that down to 2 minute 30. Okay. So the first thing is complaint, which is she had a fall 3 months ago. Got it. So let's explore about the fall first, or for which she was treated. Good for her. DEXA scan was done. Second point that I need to explore about is the osteoporosis. And that's what will take us to the next step is the PMAFTOSA. Okay, and don't ever forget the ghost with a red flag. Don't forget red flag. What are the red flags here? I can't look. What we okay. Before we can go for the red flag, what is the third point you need to discuss about is the alendronate. Alendronate. Okay. Now that we know that there are 3 points we need to do the data gathering on. Okay, the first point is her fall. Second point is on her osteoporosis. And the third point is on her alendronate. So always have 3 things at least in mind on what I need to data gather her in. Otherwise, this gets very confusing. If you don't do the underline method, then what you do is you first ask about osteoporosis, then you go back to the fall, then you might forget about the alendronate, and you'll just start screwing up your case. This is why I say whenever it's a long scenario, always underline the main points you need to question about. Always begin with the complaint and then PMAFTOSA related, and then whatever you think. Okay. Now, what was the question I asked was red flag. What should be the red flag here? Okay, before we talk about the red flag, can we start from the, okay, now you enter the room. Hello, I'm Dr. Bayam. I'm the junior doctor in the GP surgery. Are you Diana Smith? Okay, what's your age? What would you like me to do? All right. So, Diana, I understand you had a fall. Is that right? Yes, doctor. Wait, I understand you had some tests done. That's how you're going to introduce yourself. I understand because she's here for her results, as you can see over here. Oh, okay. So, Diana, I understand you had some tests done and you're here for the result. Is that right? Yes, doctor. So, what did I teach you? The structure for how to begin a results case? Always talk about purpose after rapport. All right, Diana. So, I am here to tell you about your result. But before that, can I have a chat with you? Yes, doctor. Have a chat with me. All right. So now you guys tell me, what are the questions we should ask from the first part, which is complaint? Give me maximum 2 questions. Yes, Aisha.
Okay, Rihanna, I can see from my notes that you had a fracture 3 months ago. Is that correct?
Yes, doctor.
Was it the first time?
Brilliant question. That was amazing question, by the way. No, doctor, I did have couple of, you know, tiny fractures, but they weren't like proper fractures. Like, sometimes they said there was just hairline fracture, but I've had before, yes.
Oh, that must be very distressing for you. Okay, let's talk about this time you had a fracture. Well, like what had happened?
Very good. What happened in the first place? Doctor, actually, I was walking and I fell down from the stairs in my house. So that's why I just fractured my hip.
Okay, okay. And then what did you do next?
Next day they asked me to get a surgery done, and like I got a surgery done, they fixed it. Then I was on like still I'm on bed rest.
All right, so everything went okay.
Everything's good. Well done.
Okay,
So the
okay, I
question
understand.
for a complaint, I guess this is enough. These are like ideal amount of questions. Well done, Aisha. So the most important question that Aisha asked was it the first time? Guys, who's going to tell me of the significance of why Aisha asked, was it the first time?
Because if she has osteoporosis, there's chance of like recurrent fractures,
Very good. Very good. Exactly. Well done. And then she said, what happened in the first place? And then she said, how were you treated for it? These are the main questions you can ask about a incident. Okay, before it, what happened? What happened in the first place? And then what happened after it? You got treated, and how did you get treated? This. That's enough. So whenever an incident happens, we did a mini BDA. That's fine. So Aisha's questions were good. And always remember, I think that's enough for the fall. Because if we had to diagnose what could be the what do you call it? Uh, the diagnosis that she fell down and she's here for you and she's saying that I fell down and treat me, right? In that case, we'll ask more about the complaint. But at the moment, even 3 questions are enough because we have the diagnosis. We don't need to really do much about it. We just need to do the complaint inquiry because we need to get more marks and data gathering. Now, let's come to osteoporosis. What questions should you ask the patient in osteoporosis?
about menopause, age of menopause, or if there was any surgery like hysterectomy done.
Well done. So for keeping osteoporosis in mind, you have to ask special questions, gynecological history. So what's her name? Diana. I'm sure could you tell me when was what am I trying to say? Could you tell me when was your menopause? Doctor, it was actually when I was very young. Oh, could you tell me the age? Doctor, actually, I was 30 and actually my uterus got removed because they said some blah, 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 Maybe most likely the cause of osteoporosis is the early removal of uterus and ovaries. And when there's early removal, estrogen, that amazing hormone that's helping our bones stay stronger, it's gone at an earlier age. So there's chances then these ladies usually early on develop stuff. Okay. What else? Aisha has something to say.
We will inquire about any long-term medication she's
Really?
taking, like steroids, any long-term medical conditions like kidney problems, gastric problems, any bone pains,
Wow.
any family history of the similar problem.
Very
And
good.
yeah,
That's amazing.
and
Aisha, did you study this before?
no, I didn't study that.
This is amazing because you are saying exactly what the notes say. So if you are doing it yourself, wow, well done. Maybe because like in gynecology, like these patients
Yeah,
look
this is
awful.
related to that.
Yeah, very good, very good. That's amazing. So your profession is actually helping you in this exam. That's amazing. So long-term medical condition, what is the significance of asking long-term medical conditions? Actually, not much. Let's talk about medication. What is the significance of asking medications?
Like the steroids and hormone replacement therapies, they can
Yeah.
play a role in this.
Okay, guys. So whenever there's steroid usage, that can also steroids have side effect of causing osteoporosis. And secondly, you can ask her if she's on any supplements, any other medicine. You can keep it an open-ended question and have everything addressed. Like, are you taking any medication? No, doctor. Maybe steroids, no, doctor. Any supplements? No, doctor. Okay, thank you. No need to prolong it.
And
Okay.
we should inquire about the diet as well. That is important. Like,
Brilliant, brilliant. So diet. So how could you walk me through your diet? How does it look like? Okay, do you have enough? Do you have any calcium intake, yogurt intake? How about milk and blah blah blah? Okay, and then you ask her about really alendronate related. Aisha has asked about the alendronate related questions are mostly in the long term medical condition, like Aisha asked, the liver problems, the kidney problems, because alendronate is going to side effect those places. Okay, wait. Great. Okay, so now that we know, let's go through the history that I wrote down. So you ask about bone problems, you ask about gut ulcer because alendronate can cause acidity, it can cause all the GERD symptoms, okay? And then you have kidney problems because it can affect the kidneys, or even kidney problems can cause vitamin D deficiency, in turn causing osteoporosis. Then steroids, diet, you may or may not ask social history. Once again, we don't have much time, menstrual history. So even guys, now listen, doesn't mean just because you missed steroid question, you're going to fail the exam. Steroid is an important question. You can just ask medication history, even that's enough. Just because I missed asking about gut ulcer, I'll fail that never happens. Okay. Mainly, you have to at least have addressed at least 3 main points and they'll be happy with you. Most importantly, you should address her gynecological history, her steroid related, and her symptom inquiry about gut ulcers and kidney problems and bone problems. Okay. So these are the important things you needed to ask. If you miss maybe one, doesn't matter. It's not a big deal. That's what I'm trying to tell you. Don't beat yourself. Oh my God, I didn't ask about this. Oh my God, I think I'm going to fail because I didn't say the word gut ulcer. No, you're not going to fail because of that. I assure you that. Now, coming to the management part. Okay, thank you so much, Diana, for talking to me. Now, I need to tell you. So, first thing is explaining the diagnosis. So, first things first, Diana, the results have come back and it shows that your DEXA scan was done. Um, Diana, actually, it shows that you have a condition called osteoporosis. Who would like to tell me in simple words what is osteoporosis?
Osteoporosis is a condition in which your bones become fragile and porous, weak.
Very good. So, it's just a condition where your bones become weak and they are more likely to break. As you told me, you've had some fractures before. Bones become fragile. Okay, that's about it. So, Diana, would you like to know, doctor, why did this happen to me? She might ask you. Or if she doesn't, you can tell her. It could be caused by many factors, Diana. And in your case, and in this case, guys, remember the patient will tell you that she had her uterus removed early. That's why her menstrual history was important. Diana, the reason I'm in you see there are many factors. Number one is the age. Okay, as you age, you are more prone to having it. And then there is diet, then there are other factors. In your case, which is pointing more strongly towards osteoporosis, is the fact that you got your uterus removed early. Is that right? Yes, doctor. Okay. So usually what happens, the estrogen usually keeps our bone health good. So as early as you got that removed, then estrogen was less amount of time in your body. So most likely that's why your bones have become more fragile than others at your age. Are you following me? Yes, doctor. Then okay. So would you like to know what we're going to do for you? Yes, please tell me, doctor. Now, can I be honest? Now is when the actual scenarios task will start. To explain the medication, alendronate part comes now. So that's what I'm saying. Keep the upper parts short so that this part you can finally elaborate upon. So what we're going to do is we're going to put you on a medication called alendronate. Okay, and I'm going to explain you entirely about how you're going to take this medication. So these are the only cases in counseling cases. There are only a handful of cases where you have to actually know about the medicine. You should know when to take it. You should know the side effects. But trust me, these are only maximum maybe 5 cases like this. And you'll know there's only alendronate, the medicine alendronate, warfarin. These some medical medicines you need to know about on when to take them, how to take them. Okay, not every single medication. That's the good part about platinum. So you give her alendronate. Okay, so I'm going to put you on a alendronate. This is a type of medicine that will make your bones stronger. However, Diana, I need to tell you that you have to take this. The most important point about this that you have to explain her is lifelong. You will have to take this lifelong. Oh, doctor, that is actually insane. You have to take it once on a daily basis. Okay, and let me explain to you how you're going to take it. Make sure you take it in the morning on an empty stomach. Sit upright while taking it and swallow the medicine with water. I want you to know about some side effects of this medications. This could be that you have tummy pain, could be that you have jaw pain, but just remember that we will keep monitoring you. Most likely you won't have these, but you should have an idea about these side effects. Are you following me? Yes, doctor. Apart from that, I will also write down some calcium vitamin D tests for you. And I do advise that, Dana, try to improve your calcium intake from your diet. Okay, and I will also prescribe you some supplements for calcium. Are you following me up to now? Okay. And then we will review you in 5 years. We will do another DEXA scan to see everything's going good. All right, doctor. At any time you have severe tummy pain, like exaggerate the tummy pain, come to the hospital immediately. Or if you have tummy pain, or you can talk related to her osteoporosis. At any time you have a fall, just let it go. Just say tummy pain. Okay, let's show you this case now. Um, yeah. So this is the case. Diana Smith, blah, blah, blah. So if you look at this, now that I'm going to teach you a little bit how to study the notes because you're going to that part of your preparation now. So that's the whole scene, guys. That's the whole scene. The scene is that ignore that this, oh my God, please don't look at the name of the academy. I'm so rude. Okay, so what you're going to do is, honey, as you can see, I can see from my note you're here for a follow-up. Nobody cares. Can you tell me a brief recap of what we asked? Okay. There's so many questions. Do you have this? Do you have that? Do you have this? So many questions. You don't need to necessarily go through all the questions. Your main points should be in your mind, which is bone problem, gut ulcer, kidney problem. Diet. That's it. Okay, if you want to ask about smoking, go ahead. Why not? any painkiller, any long term, any, just too many questions, honey. Just keep it to the main points. Who do you live with? What sort of accommodation do you live in? I know you're 60. How long ago was you? Blah, blah, blah. I had my womb and ovary removed at age of 35. That was the whole scene. Any hormone replacement therapy. Thank you so much. Okay. Now I would like to have a look at you and BMI and blah, blah, blah. Okay. Thank you. The scan that you had is called a DEXA scan to assess how strong your bones are. From the assessment we had, you're having a osteoporosis, weakens the bones, making them more fragile. Okay, we are suspecting it might be related to several factors. Could be age, your case, it could be the ovaries being removed, causing reduced estrogen hormones. Okay, and it could be sometimes in family as well. It could be dietary risk factors, blah, blah, blah. So we're going to do some routine. So these are a lot of investigation. If you can't remember, we're going to do some routine tests and we're going to measure your nutrient levels. Like these are nutrients, right? Vitamin D and calcium level. Even that much is enough. We will prescribe you medicine called alendronate to strengthen your bones. You will take it once daily. Just keep it, either choose this, either choose. Don't say, I will give you once daily or once weekly. Please don't confuse the patient. Choose your own, okay? Once daily, just do one. Take it on early in the morning, glass of water, upright position. You can eat 30 minutes after it. Decided tummy pain or blah, blah, blah. And you mean, okay? So calcium, vitamin D supplement. And no need for, don't go for hormone replacement therapy because that's like I think you need to refer to gynecologist for that. What the heck does it mean? I will start you on hormone replacement. That's a very risky thing to say. So I say remove this part. When you are doubtful about some part, which is not even that important, leave it. Okay. And apart from that, if necessary, just if it says if necessary, don't mention it. You don't have much time. Only keep the main points in your mind. Side effects of medication, like if you have severe tummy pain, come to the hospital, or severe jaw pain, come to the hospital immediately. That's about it. So that's how you literally, we did this case in 5 minutes is an understatement, maybe 10 minutes. So this is, and now you just practice it with your partner or yourself. That's how you should study for this exam. So now you know the alendronate counseling. Oh my God, what is wrong with me? Counseling. Counseling. Okay. Now let's talk about my favorite case. This is the learning disability. Now listen very carefully. Let's erase the ugly writing, please. Thank you so much. Now you guys will help. Okay. You guys are going to answer with your beautiful concepts. Now listen. This is the case. Okay, first let me teach you what is the structure for learning disability. So learning disability is, don't worry, they will say it in the prompt, okay? They will say it in the prompt that this person has learning disability. Now, what is a learning disability? It means that it could be anything. Listen to me. Don't get stressed out. Oh my God, he's abnormal. I'm awkward. Should I ask him? What is your abnormality? That sounds wrong. So I don't want to ask him. Get it? Like I get how like you get a little like awkward when it comes to someone who's not normal, and then you're like, do I ask him? Honey, you are, as a doctor, you have to ask about everything. So the answer is yes, you have to ask him about his learning disability. So W rush questions. This is my OG mnemonic. Nobody knows this mnemonic, okay? And this is what you're going to do is, whenever a person with learning disability comes, always question him on him, what is his learning. And I can see from my notes, you also have a learning disability. Yes, doctor. Could you tell me what type, what W? What type of learning disability do you have? Doctor, I have dyslexia. Or he can just say, doctor, I haven't really studied. I was a dropout in grade 4. I did not go to school. He can say anything. Or he can just say, doctor, actually, I have maybe myopia. I don't know, maybe like a doctor, I'm actually autistic, like anything. But you can never know. You need to ask him what type of learning disability do you have. Okay. And then the next curiosity, are you able to read and write? No, doctor, I am unable to. Okay. How do you usually manage medical information? Doctor, my mother helps me with it. So the mother is your sign to take the help of the mother. Okay. Be like, this is a very important task that, okay, his mother normally helps him. So in the management part, you're going to be like, okay, you can ask your mom to do it for you. You can ask your mom to remind you to take the medicine or whatever it is. Okay. S is for support. Same question. Do you have anyone that helps? If he says, if you ask, how do you usually manage your medical information? And he says that I usually set an alarm on my phone. Then you can ask, do you have any support? Is there anyone that helps you with the medical information? Anybody that can help you? Yes, doctor, my roommate. Okay, how can we help you better understand today's consultation? Doctor, you can help me by just write, tell me slow. He can say anything. So for learning disability, always remember, whenever there is a case where the prompt says that there's learning disability in this patient. So what are you going to do? In the data gathering, add the W rush questions, and in the management, add this. Explain in damn simple. Before you were explaining that osteoporosis weakens your bone, making them more fragile. In learning disability, even simpler words. You are going to go to nursery class. First, you were teaching a grade 8 student. Now you're teaching a nursery class baby. You're going to say, see, bones are like sticks. And then sometimes some sticks, when you put them in water, they get very fragile. So that's what's happening to you. So this is literally what you're going to do in learning disability cases. So your explanation should go 10x simpler than a normal explanation. You're going to keep repeating. You're going to keep asking, am I making sense? Do you want me to go over this again? Okay. And then, okay, Diana, I'll also write everything down so that you can go home, you can show it to your mom. And if you don't understand it, she can also help you with it, because the mom was our help. Mom was that angel we need. Are you following me? Yes, doctor. Pillbox reminder support. Forget that. We'll talk about it in a while. Okay, so for learning disability, now you know whenever a learning disability person comes, oh God, BPPV, I hate you. Anyway, I can't, the more I exert, I'm dizzy. What the heck, guys? What is this crystal situation? It's like we studied it in ENT, but we never imagined it on ourselves. That's crazy. Okay. Now let's go to my favorite scenario. Why do I call it my favorite? It's actually one of the most difficult scenarios. So guys, it's the thing, the more difficult the case is, the harder you work on it. The harder you work on it, the more you like it, because you're giving it more time. You know how kids are so difficult, but because you give them so much time, you start loving them more. Oh my God, that's so deep. Anyway, so coming to this, listen very carefully. The reason why I say there's a difficult scenario, there's too many things in this scenario. Like you can see it's a John Smith guy, Mr. John Smith, 33-year-old, came for a routine follow-up. He was diagnosed with, there's so much information, my love. He was given warfarin. He is diagnosed with disability. He has INR results. The nurse who asked you to talk to him, explore the reason why. So you can see the INR is coming low. Target of INR should be 2 to 3. So your INR should be at least 2 to 3. Nobody knows why this is happening. Okay. Ready? This is one of the most difficult scenarios, and the cool part about the scenario is that it's actually coming nowadays in the exams. Okay, so John Smith is a 33-year-old, came in for a follow-up, diagnosed with DVT, warfarin, learning disability. INR should be 2 to 3, but it's less than the 2 to 3 value. So our major point in this case is something is wrong. Why is his INR not? It means his treatment, something is up with the way he's taking his warfarin. What do you guys think? Why is INR low? What could be the cause?
He's not taking.
Maybe he's on some medications.
Well done. So most likely that the reason his INR is so low is because he is on under treatment. Remember this. So if you don't understand the whole INR situation, then how the heck will you go about this case? So normally INR is supposed to be 2. If it's more than 2, just remember this in your life, okay? If it's suppose 4, 5, that means, honey, calm down. What are you doing? Like, stop taking so much of warfarin. But when it's low, it means you're not taking enough warfarin, which means, what is the risk when you're not taking enough warfarin?
Clot formation.
Well done. And what is the risk if you're taking too much warfarin?
Bleeding.
Very
Bleeding.
Well
thin
done.
blood, yeah.
These basic concepts you should know, okay? So now if we come to like, okay, this is the prompt. You're standing outside the cubicle. You have 1 minute to read the prompt, and this is the damn prompt you get. You're just like, there's too much information. Okay, so what am I supposed to go for? So you guys are going to tell me the underlying method I just taught you. What are the important things you need to talk data gather about in this case? Who's going to tell me? Number 1,
DVT
brilliant.
and DVT, warfarin, and learning disability.
Very good. So remember, underline your 3 major things and then talk about them. The INR situation, we will deal with it in the management. But the data gathering part, I need to gather data about his DVT, about his warfarin, about his learning disability. Okay. So this is the important thing. In counseling cases, the majority students have cried about this one thing. And the one thing that they always cried about was that, what am I supposed to ask him? There's too much information. Like, and I've seen them perform. They're first asking about warfarin, then they ask about, they're not even touching learning disability, because learning disability is very awkward thing to ask about. And then they go into complaint inquiry. So no, first always begin with complaint inquiry, then go to the medication history and stuff. Okay, now, how do you start this case? I think, guys, always begin with complaint and learning disability. Learning disability, get this out of the way. What is the W rush of the learning disability?
What
Okay.
of learning disability do you have?
Okay, go. I'm John. Ask me my learning disability questions.
All right, John. I understand you have a learning disability. Is that correct?
Yes, doctor.
Okay. Could you tell me what kind of learning disability do you have? Are you able to read or write?
I am unable to do any, and actually, I've been diagnosed with some the disease, so I can't.
Okay, all right, I understand. So John, tell me, how do you usually manage your medical information? Is there anyone at home helping you out with it?
Yeah, I have a roommate that usually reads stuff for me and, just reminds me to do things.
That's great. Um, and how can we help you today to help you understand the consultation a little better?
This doctor, all I want you to do is, could you just write everything down? I would love that.
All
Appreciate
right,
it.
definitely that can be done. We'll be sure to do that.
Okay, well done, Arshi. So who's gonna tell me what is S question? Because I forgot about it.
As for support, but since you already mentioned that
Very
you
good.
have support, like your roommate is supporting you in
Perfect.
the medical information, I didn't ask that.
Everything, you did it perfectly. There was nothing missing in what you said. Just going through brainstorm. What was it? How do you want us to help you? Help. Okay. So these are the W rush questions. It's up to you, honey. It doesn't mean just because you didn't ask one S, that doesn't mean you're going to fail it. Even if you ask 3 of this, you just have to show to the examiner that, honey, I know the W rush questions. I'm not like completely ignoring his learning disability. Okay, so please acknowledge everything. Don't gaslight and plab too. Now that you've asked about learning disability, all right. So John, I can see you have this.
Really sorry to interrupt. I just have one question. So, about the learning disability, do we need to signpost, or when he says that he has a learning disability, do we need to apologize? Like,
No. See, learning disability is something he lives with. He probably doesn't think it's like a big deal. So we
okay,
shouldn't make him feel like, he's not.
okay.
Yeah. So what you're going to do is now you're going to go to, okay, I can see your learning disability. You're going to ask Arshi questions. Once you're done with the Arshi questions, yeah, we're going to call these questions Arshi questions. That's the new like cool thing. Sorry, Arshi. So these are the Arshi questions. Guys, what are the Arshi questions? W rush learning disability. Okay, guys. So you guys don't forget it. Now we've talked about his learning disability, done, tick. Okay, now we need to inquire about his DVT and his warfarin. What should I ask about first? Let's see who knows. Think about your structure.
We first asked them about the DVT and then asked them if they were started on any medication for it.
Very good. So always do complaint inquiry before PMAF-TOSA. So complaint inquiry, he was diagnosed with, let's talk about the complaint he had. He had DVT, right? Let's see how much he knows about that, honey, because he's learning disability. So, okay. So, John, I can see from my notes you have a condition. Kindly do not say DVT. What did I tell you for DVT? Keep in mind, you have to be very simple in this conversation. You have to adjust yourself with learning disabilities, right? So could you tell me, I can also see from a note you were diagnosed with a condition. Is that right, John? Yeah, doctor, I did have some condition, but I'm not sure what it is. He's most likely not going to know what it is. Okay. So now you know that in your management part, you need to explain about it. Okay. So don't assume he knows very well what is DVT. Okay. Could you do you know what happened exactly? Do you know what the condition is? Assess his understanding. Doctor, actually, they just told me there's some pain in my leg, so there's something wrong with my leg. That's all they told me. All right, okay. And can you tell me how your leg is doing now? That's a complaint inquiry. Doctor, it's doing good. Okay. Anybody has a red flag in this situation? I think I'd ask my red flag at this
Any
point.
breathing difficulty you've experienced?
Very good.
Chest pain and shortness of breath.
Very
Yeah.
good, very good. So don't forget your red flag with complaint inquiry. Okay, at the moment, how are you doing? At the moment, how's your leg? And at the moment, do you have any chest pain? No, doctor. All right. Now let's go to this medication you were given. Is that right? Do you know the name of the medication? Doctor, no, I'm not sure about the name of the medicine. I'm just taking a medicine. Okay. So did they tell you why you're supposed to take this medicine? Yes, doctor. They told me that it's going to make me feel better. And did it work for you? I don't feel that it helped me much, doctor. Okay. Now you're going to basically explore about the warfarin. Could you tell me how you take how they told you to take it? Doctor, they said take it every day. And are you able to follow? Doctor, actually, I kind of forget sometimes. So yeah, I kind of like take it every other day because I always forget to take it like every day. Okay, and how do you have any reminders? How do you normally take it? Like, is there anything that reminds you to take it on a day? Yes, sometimes I set an alarm, but then, doctor, I completely forget. Whatever. Okay. So keep it short. End the questioning now. Okay. And have you noticed any kind of bleeding in your body anywhere? No, doctor. And have you noticed any chest pain? No, doctor. All right. Thank you so much for talking. So this is how you do the data gathering part of a learning disability. So let's organize it. First, you question about the learning disability. Then you question about the complaint. Most likely you'll ask about the DVT and you'll assess his understanding and you'll ask about his red flags. Then you assess about his warfarin intake. How often do you take it? Are you taking it as usual? Because this entire scenario is based upon the fact that he's not taking it properly. Okay, once that's done, now you come to managing him, honey. You literally have to manage him like he's a child who knows nothing. So from after talking to him, you realize he does not know what DVT is, nor does he know what the heck is the seriousness of it. So if you leave it to me, I'd 100%, you know what I do? I'd tell him how risky the situation is. I'd scare him a little bit so that he's more serious about his medication. So you can start by, okay. And thank you so much, John, for talking to me. So John, let me explain to you about what happened and what medicine they gave you, okay? So first part is always explaining and orienting the patient where everyone's head is at. So first things first, John, keep your mind organized, guys. Keep your mind organized. First, you need to tell him about DVT, tell him about warfarin, and then you address this. Okay. So let me tell you firstly what's going on with you, John. Okay. You were diagnosed with a condition called DVT. Let me explain to you what it is. All right. It's basically when your blood, that's normally like water, it starts to clump up like ice. Does that make sense? So this is the difference you're going to make. In a normal patient, you'll be telling, so DVT is a condition where your blood starts to clot. And when that clot happened in your leg, that's DVT. But in a case who is a learning disability, I hope that's a word, a learning disability person, you say, your blood is like water. It becomes ice. Your blood is like milk. It becomes yogurt. So basically, you're going to be teaching a nursery student in a learning disability. That's the difference between learning disability and a normal patient. Okay. So who's going to open their mic and tell me in a cute way how to explain what warfarin, what role warfarin plays in DVT. You should have, I want to train you guys to speak in simple terms, in one line. So simple terms, one line. Make that a rule for PLAB 2. Try to speak not more than one breath. Make it more a conversation.
All right, John. So
Yeah.
now that we've understood that the blood in our body is like water, and sometimes what happens is that it freezes up and it becomes ice. The pill we are going to give you, this is known as warfarin. What it's going to do, it's going to go to that ice block and it's going to break the ice so that your blood can flow again.
Well done. You guys see that? Well done. Okay, so you're gonna make it like you're literally teaching a nursery class, okay? And he'd be like, oh, doctor, that makes so much sense. Okay, that's why we are giving you the warfarin. We're giving it you on a daily basis to make sure everything's okay. Now, the whole scene over here, what happens next is that, Arshi, what do you think is the next, what's our next priority? Before we tell him the result, what do you think is our priority in this case to explain him what?
It's very important for him to take it regularly. Otherwise, the ice, it'll freeze again. And the ice might like reach up to his lungs and cause him
Very
problems.
good. So this, what Arshi said, guys, now listen, I'm going to bring on the art of counseling in this. Now comes the part on convincing him to take the warfarin. How do you do that? You scare the damn crap out of that man. I'm sorry. I'm so sorry. But that is the art of counseling in this case. Okay. You have to tell him, now listen, John, I want you to know that when there is ice or there is clumping in our leg, that is very dangerous for us. That is life threatening, John. We need to make sure that as soon as we can, we remove that ice from your body, right? And that's why we're giving you warfarin. If you don't take it, that ice might dispatch in areas that can be very life threatening for you. Are you following? So basically, the art of counseling in this case comes scare him. Okay, because I assure you, if I really relate with this scenario, I'm not taking my medication seriously. If someone scares me that, bro, you're not taking your medicine, do you know what it can do to you? That's the only way you can convince me to take that medicine. You get what I'm saying? Actually apply counseling to yourself. Like if suppose I'm not doing a certain thing. If someone's scared, bro, are you crazy? Are you crazy? You're eating junk food. Do you know what's happening? These days they're pumping like carcinogens in the junk food, and that's the instant I'll stop taking junk food. You get what I'm saying? That's how you convince someone. You scare them. Okay. So I'm telling you, so at the moment, John, let me explain to you. I just got your so you're gonna relate it to the INR results now. So listen very carefully to me, guys. So John, first step was to tell him what is DVT. Second step was to tell him how warfarin helps. Third step is to scare the damn out of that guy. Now you go to the results, okay? Because in learning disability, go slow. So John, actually we got your results done and it showed in the results. Kindly guys, listen to me. Please don't tell a learning disability that, honey, your INR, which is marker of the warfarin, is target is 2 to the, he will not understand BS, okay? I'm sorry. Please don't say INR. Just say, we did your test and the test gave us an index of how well you're taking your warfarin, and it shows that you're not taking it that much. That's all, honey. That's all. So the whole INR result nonsense, and you're probably like, oh my God, there's so much. How do I like explain it to him? It's so confused. No, you do not even need to explain that much. All you need to tell him, the result came back and it basically measured how well you're taking your warfarin. It seems like you're not taking it well. That's what the results are reflecting. No need to say INR and target is 2 to 3. Say INR. Don't say target is 2. First week it came out to be 1.2. Second week it came out to be 1. No. Number one, you're wasting your time. Okay? We don't have the affordability to waste time. Second thing, he is a learning disability person. He won't even understand what 1.2, what 1.4. Just get to the damn point. Just say, honey, basically, INR shows how well you are taking the warfarin, and in the result, it shows you are taking it less. That's it. So that's why I said keep it simple. You're going to a mechanic, the mechanic comes to you, yeah, your car is unwell. It shows that the meter reading is 5.7, and then last week it was 3.7. So, bro, just get to the point. Oh, yeah, I just wanted to say that your meter is broken down. That's it. Get to the point. You get what I'm saying? So that's the same thing. So we're not basically telling our professor. We don't need to tell 1.2, 1.4. We're talking to a patient who doesn't give a crap. Just tell him the gist of it. So now that you've addressed the INR as well, all right, are you following me up to now? Yes, doctor, I get you. So it's very crucial for you to take the warfarin on time. So first we talked about what is DVT, then we told him what is warfarin, but don't say any of these in more than one breath. In one breath, explain to him DVT, and then in one breath, go to warfarin. It shouldn't take like a year to, give a speech of all of this stuff. This is something nobody teaches in PLAB. This is what I'm trying to aim to fix in everyone. Then you tell him about scary, bring the ghost here. Then you tell him about the INR result. Now that you've told him, now you ask him, are you following me? Yes, doctor, you're right. I should take. The moment he says, yes, doctor, you're right, you have nailed, you have 100. If the simulator says, yes, doctor, you are right, your entire purpose, the whole counseling case, you have passed, because that was the whole part of counseling. Was he convinced by you? Basically, you become a salesman in counseling. Okay, you get what I'm saying? So yes, he's convinced that he needs to. Yes, doctor, you're right. I should take my medicine on time. Okay, would you like me to give you some measures on how you can take it on time? Yes, doctor, please tell me what I can do. So you just give him solutions. Just give him solutions. Set an alarm on your phone. I can give you a pill box reminder. Okay, I can also write it down so you can give it to your mom or your caretaker, whoever. They can read it for you. Honey, please don't say all these three. Choose one point, please. You don't have much time. Once again, I'm saying. So pill box reminder, okay? And, make sure you are taking it on time. You can set an alarm on your phone at the same. You can put sticky notes. Honey, be creative. Try not to use everyone. The more creative you are, the more the examiner will be like, huh? This candidate is unique. I haven't heard that solution. And it's actually a very nice solution. Okay, so for instance, tell him that you can put sticky notes on your wall. This isn't no notes. I just made that up. Put sticky notes to remind you, maybe in your kitchen because you cook breakfast, maybe in your living room, your drawing room where you sit, where you play games, put it there, put a sticky note everywhere. So it's a reminder for you. How does that sound? Yes, doctor, that sounds good. And at any time you have chest pain or you have any bleeding from anywhere, come to the hospital immediately. That's it. End the case. Kindly do not go into long, lengthy definitions. You don't have time in Blab 2. You have only 4 minutes. So who's going to tell me all of these points, and I'm going to time you and I'm going to prove it to you that this can be easily done in not more than 3 minutes. I'm going to put a timer of 3 minutes. Who would like to attempt this entire case? Explaining him? Yeah. Aisha, go ahead. Okay, I'm turning on your timer. Explain and do it like I'm a patient and do the are you following me as well. I just want to prove to you guys that it's possible to do it in 3 minutes.
Okay.
So here's the timer. I'm starting. Start.
Should I start? Okay, well, John, thank you so much for talking to me. Let me explain you the condition now, okay? So, John, you are diagnosed with a condition that is called DVT. Do
Okay.
you know about it?
No, doctor, I'm not sure.
Okay, let me explain it to you. It means when the blood, which is like a fluid, in your veins, or it's a pipe like, it becomes yogurt or ice like, okay, and it
Oh,
blocks the pipe, okay,
got
and that's what happened in your case. So what we are going to do, we did that, we give you warfarin. And why we gave it warfarin? Basically, it goes there, and uh it break that ice so that your blood can flow again. All right.
Okay, that makes sense.
So, okay. So listen, John, when ice and clumping in your legs, it is life threatening. So we need to remove it. This is because you will, if you will not take that medication, it will not break the ice, and it will go to the areas like your heart and lungs, and it can be very life threatening. All right.
Okay.
Okay. So are you following me?
That makes
So
sense now.
John, Okay, so John, actually, now we got your results, and I want to tell you that it's telling that how well you are taking warfarin. And it seems like you are not taking it in a correct way. Okay, that's
Yes.
what results are reflecting.
No, doctor, I
So
want to take it regularly now. I'm sure about that.
that's very good. So that's very good. So it is important for you to take it regularly.
Yes, doctor.
Okay, so you should take it on a time every day at the same time, regardless you are having pain or not. Okay,
Okay.
do you think you can do that?
Yeah, I guess.
That's great. That's great. So just I would suggest you something like set a reminder on your phone, or your family members can help you, and just post the most easiest thing, just post a stickers on your wall, and just that can be very helping for you. Okay.
That makes sense. Okay, doctor, I'll do
Okay.
that.
Okay. And when you go home, and if you will experience any chest pain, shortness of breath, please do come to us as early as possible. Anything you want to ask?
No, doctor.
Okay. Thank you so much, John.
Thank you. She still has 28 seconds remaining, guys. And you can see that it's 100% you did this entire management in, what do you call it? In 3 minutes. Although like 4 minutes is allowed, but I gave you 3 minutes. And can I be honest with you? This is PLAB 2. The essence of PLAB 2 is the way Aisha just did this scenario is, honey, her brain was very organized. This is what was going on in her brain, a structure. So this is what I'm trying to explain to you. If you have a structure in mind, you can make up the dialogues and you'll have the time in your mind. So it's not going to be a bunch of information going on, rather just a structure. And all Aisha was doing, ticking one part. Are you following me? Ticking the second part. Are you following me? Priority, scare him. Tick, very good. Then she moved to INR. So when you have a structure only, then you'll have that urgency in you that, okay, I need to move to the next part. Okay, I need to. And so beautifully she finished her case. So gracefully. It was so gracefully. Like an examiner will be impressed by this. And that's how you're supposed to go about lab 2. Well done, Aisha. That was brilliant for a first timer, for someone who has an exam far away. That was amazing. That's why I say keep a structure in your mind. If I haven't made a structure for you and there's a very difficult case, make your own structure, but stick to structures, not big notes. Please don't memorize big notes. This is how your brain should have this only, nothing more than this for this scenario. Your brain shouldn't have, and that book said, and that book said, no. Only one structure that is specific to you, unique to you. Nobody else followed that. Nobody said, put sticky notes on your wall. It should you have your essence, not even my essence. You should have your own. That's what they love. They love uniqueness. So that's how you do the learning. Learning disability case is one of the most difficult cases. I have taken, what do you call it? I've taken mocks on it. After schizophrenia, I think this would take the win because there's a lot of information here. And you don't know what to talk about. There's so many things to tell him. But how smoothly you tell him how life-threatening it is and smoothly sneak into the results, that's beautiful. That's beautiful. So we're done with learning disability. Well done, Aisha. Thank you for that. That was amazing. If you don't try, how will you ever know that you're so good at this? And you can tell that Aisha's hard work is showing. Aisha's been here since day one. You can see it in the way she performed. Now let's go to convincing someone. A quick analysis of the other scenarios of counseling. Q-risk score. Okay, so Q-risk basically it's a type of score that tells you how. You're welcome, sweetheart. So Curious tells you what are the chances for you to develop a future cardiovascular event, right? So there's this person that'll come to you. Let's see. Luisa. Wow. Louisa has come to you, age 61, follow-up, blood tests include LFTs, blah, blah, blah. Only cholesterol is found and Q-risk is 16%, which is she has 16% chances of having CVA in the future. She's to be started on statins. Addition for BMI 28. See, 169, her BP is high. Cholesterol is 6.9. What you talk to the patient in a shell. So basically, we're going to do her statin counseling in this case. So we're in PLAB 2, there are only few medicines you need to counsel about, you need to talk about. One of them is alendronate, we've already talked about it, and then is statins, okay? So in this case, very easy. Once again, you complaint inquiry. There's a lot of information here. What did I teach you? The underline method. Let's do the underline method. What's important? What am I going to talk to about Louisa? What am I gonna say? She's here just for a follow-up. Got it? So it's not like she's here for a complaint. The blood tests are done, cholesterol is found high, Curis is a statins. I think we can talk about her cholesterol situation. So we can talk about her current symptoms related to high cholesterol, then PMF-TOSA according to high cholesterol. Okay. And her Curis means we can PMF-TOSA her about the cardiovascular events. Are you a long-term medical condition? Do you have any, how's your diet like? Are you smoking? All of these things come in Curis score. And third thing, we need to talk about statins. So we'll ask her about any side effects of statins that she's already, if she has any kind of this. Okay, let's learn that. So three things you need to underline. Now you'll easily be able to make a structure in your mind to ask questions. So first you'll ask her, have you ever had any long-term medical condition like a maybe perhaps heart disease? No, doctor. Any kind of any time where you felt like you are losing control of your limbs? No, doctor. That's good to hear. Do you have any long-term medical condition? No, doctor. Do you have currently any kind of condition? Okay. Are you having any chest pain at the moment? No, doctor. Okay. Is there any other thing that you'd like me to tell me? Okay, how about your diet? Could you walk me through it? Could you tell me if you smoke? Do you drink alcohol? These are all important for CV events, okay, CVEs, because Q risk is the whole thing in question. Now you'll talk to her. All right. So thank you so much for talking to me. What's your name, Louisa? Basically, your results have come back. Okay. And basically, Louisa, is that your results show that your cholesterol is a bit high. Okay. Are you following me? So usually we calculate a score which tells us how prone you are to developing any cardiovascular disease in the future. Are you following me up to now? Yes, doctor. So we calculated it and it came out to be 16%. So you have 16% chances of having some cardiac or some vascular event in the future, which is not too much, Louisa. However, to reduce this risk even more, we are going to start you on a medication called statins. Up to now, are you following me? Yes, doctor. Okay. Would you like me to tell you the instructions of taking this medication? Yes, doctor. You are going to have to take it lifelong. You guys won't get it, but the word lifelong, you have to take it lifelong, is actually a huge milestone for people. Okay. So people actually get worried. So tell this in a more sensitive way. You will have to take this medication lifelong. It's because your cholesterol is on the higher side and we need to bring it lower. So you have to keep that going. Maybe she had some incident like a hypertension attack or something. That's why you can use that. As you told me, you have hypertension. So it's necessary for you to be on it lifelong. You are more prone to having higher cholesterol. Okay, so you're going to take it once a day at night time. Up to now, am I clear? Yes, doctor. Let me just tell you about some side effects this medicine has. You might have a minor tummy upset. Sometime it can lead to liver problems. But remember, we will be monitoring you throughout. Most likely, everything will be okay. But we need to tell the patient, we need to tell you about the side effects. Okay, doctors. Okay. And at any time you feel like there's pain in your muscles or you're feeling like there's pain in your tummy, come to the hospital immediately. I will give you a leaflet. You can even read about the Q risk and statins if you like. Okay, so leaflets is usually when there's more information you want to say, but the time is up. So very easy. Same thing like others. And you just assess her data gathering should be related to cardiovascular events. Red flags should also be according to that. And then PMF-TOSA, and then special questions also according to CV events. And then comes to explaining part. In explaining part, how did you explain? First, you mentioned about her cholesterol being high, which led you to deduce her Q risk score, number 2. Number 3, you tell her what is Q risk score. And number 4, you introduce statins. And then you counsel her on statins. So that's how the structure should be in your mind. The more structured and organized you are, the better you'll perform. So this is one more, like another case. And then you have another case where a patient will come to you. He's going to be like on hypertension medicine and he'll be like, doctor, I'm having cough. And when you talk to him, you find out he's taking ACE inhibitor. All you need to do is, I would like to change this medicine to candesartan, which is a ARB, which will remove the cough part. Okay. Now, if a patient who is on calcium channel blocker will come with leg swelling. Doctor, this medicine is causing leg swelling. You will rule out all other causes of leg swelling. And then finally, you'll say, okay, I would like to change your medicine to captopril. And that's about it. That's literally the management. Okay, so whenever these are the only medicines you need to know in PLAB2, the ones that I'm teaching you. So whenever there's enalapril causing cough, you go to Candesart. Whenever there's amlodipine causing leg swelling, you go to captopril. Now coming to smoking cessation, I guess we've talked about this on my my addiction day, alcohol abuse day, or I didn't. No, I did not. I did not talk about smoking. I talked about alcohol. So now let's talk about convincing someone to stop smoking, to lose their weight. The hack, we need to fit the art of counseling into these. What is the art of counseling in obesity and smoking cases? Telling them to start slow. Okay, give me a second. Wait, guys, be right back in 2 minutes. Okay, we're back. Honey. So my previous student who was Alero, she gave me this amazing, what do you call it? Slogan, slowly but surely. So that's why I mentioned her name. See, I don't forget my students. Erased. I'm so rude. Anyway, so what you're going to do is let's talk about smoking cessation. Patient comes to you, he wants to get rid of it. He's like, doctor, actually I smoke. And then you talk about his smoking. Okay, you ask about explore addiction. How many cigarettes do you smoke? I smoke about 10 cigarettes a day. Okay, and how long have you been smoking? Doctor, it's been 7 years. Okay, and then when you have to what let's see how you guys, what are the red flags in smoking? Like smoking scenario, what red flag questions will you ask? Don't forget, red flag questions should be everywhere.
Any cough, chest pain, shortness of breath?
Um, sorry. Chest pain. Chest pain is a good one. Because red flags are dying. Not red flags are not smoking related diseases. Red flags are what can kill him with smoking. I think what can kill him with smoking might be we should. Anybody else would like to try?
Anybody you know that is smoking and died of lung cancer or something like that?
Brilliant. She's close. So red flag questions are, if I say ask his symptoms and assess, red flag questions.
Weight loss, of course.
Very good, very good. Okay. So cancer situations. Cough and cough, no. just cancer. Okay, let me just go to this scenario. Where is this scenario? Yeah, so you are in FY2. Mr. Winston will come to you, 61-year-old. He is known to have COPD, and yeah. So basically, the whole scenario will come in the form of COPD uncle. Like there's be an uncle, I'm so rude. He'll be like a COPD person. And then the whole prompt will tell you, convince him to stop smoking because he's always having recurrent chest infections. Okay, so then what you're going to do is you're going to investigate about the COPD first, then you're going to investigate about the PMAFTOSA. You're going to go for the inquiry. Could you tell me how many cigarettes you smoke? How long has it been going on? Have you tried to cut it down? What was that? What was the, what do you call it? What was the questionnaire we used?
KH,
Well done.
KHTWD.
KHTWD. Well done. Okay, so you quickly assess the KHTWD, but not the entire KHTW. You can just say, have you tried to cut it down? Okay. Do you get annoyed when people tell you to cut it down? Okay. And what is your motivation to quit even if you did cut it down once, blah blah blah. Okay, now anyway, once we're done with that, coming to the
Dr.
management
Hasna,
part. Sorry, is there
Dr.
anything you
Hasna, yeah, yeah,
Mhm.
yeah. Dr. Hasna, when, like, for example, in this scenario, we know that, this person has come to us for the smoking cessation. So, are we going to, like, directly start from the history, like, the presenting complaints would be, like, directly from the smoking thing, or, like, we need to ask about COPD?
Honey, very good question. Always begin with why did I teach you that structure that you need to throw yourself back onto, is because you always go in that order. Always. No, you get what I'm saying? This is
Mm,
always the order. So you have to go in order. You have to go structure complaint, explore red flag, then go to PMAFTOSA, and then come to your DESA question. That's when you explore about smoking. So what you're going to do in this case, because you know it's going to be smoking, we need to assess. So you do this quickly. You only go through this very quickly. How do you go very quickly? You go for the priorities. What is the priority? Quick assessment. How's your COPD being managed? Okay. And could you tell me red flag question? Have you noticed any weight loss? Have you noticed any lumps and bumps on the body? All right. And could you tell me if you have any long-term medical condition, any family history? Okay. Now, I just want to inquire about your diet a little bit. How's that going? Okay, that's good. All right. And could you tell me, do you smoke? Yes, doctor, I smoke cigarette. Yeah. Okay. Can you tell me how many? Can you tell me how long? Okay. Have you tried to cut it down? Okay. So you get what I'm saying? So just go quickly through this, but you
mm,
have to go structure wise. Structure is important.
okay,
There's a whole
okay,
marking criteria which says structure. Okay.
okay, okay.
Okay. Now that you've asked him everything, you go to convincing him. Now, the essence of counseling in this case is to somehow tell him to at least cut it down. So, guys, what are the NHS services available for smoking cessation? First, let me teach you that. The things that you can do is there is a whole smoking cessation clinic for people like that. Okay, there is a whole smoking cessation clinic. In the clinic, they will help you set a quitting date, and then they will help you get through it. There are medical therapy. For instance, there's nicotine replacement therapy. There is bupropion. They give you these medicines. These help you reduce the cravings. They give you the nicotine, but in lesser amount. So they help you reduce the craving. Apart from that, there are smoking support groups, and these are like people similar to your state, and when you talk to people that can relate with you, that's very helpful for you. And apart from that, e-cigarettes is like you can use e-cigarette for a replacement at first, but I wouldn't recommend that you take it forever. Also try to cut that down as well, but that's going to help you get to the leaving the smoking part. So this is the whole situation with the smoking cessation. Now coming to telling him how to do it, that's going to be the art of counseling. All right. Thank you, John, for talking to me. And guys, let me just show you the scenario so you know what's going on. So Winston has come to you, 61-year-old, blah, 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 COPD, inhalers. He's getting recurrent infection, prescribed antibiotics. Your nurse colleague examined. She has been talking about smoking, reluctant to stop. He has been reluctant to stop. She says, go talk to him, please. Please talk to him, take a focus history. And then you begin with what just happened. Can you confirm your name and blah, blah, blah. So I can understand you've been admitted with a chest infection. Yeah, it wasn't so good, blah, blah, blah. What about the phlegm? Okay, good. Does it contain, you're doing the red flag question. You are doing the complaint part. Did it have blood? No. Good. That's a Good thing. How are you feeling now? That's about it. So obviously, guys, remember, notes will say 10, 20 things, but you're not going to ask 10, 20 things. That's the whole scene. This is where people do wrong. They start asking all of these questions. If they don't ask, they feel like, oh my God, I missed that. I'm going to fail. You just have to ask, does it contain blood? Okay, thank you for telling me. I can see from my notes you have repeated chest infection. Yes, doctor. I'm sorry, it must be uncomfortable to you. Okay, now we're exploring. Since when have you been diagnosed with long-term medical condition? Okay. Okay, can you tell me? Smoking is a common, it is a group of lung. Okay, whatever. What sort of medications are you being given? This. Okay, good to hear. Okay, could you tell me if you smoke? Yes, doctor. Could you tell me how many days? How many cigarettes? 30 for okay. Has have you ever thought of maybe cutting it down? Or maybe you can ask this question that's written over here. But remember, try to make your own script, your own dialogues. I'm sorry, what have you thought of trying to stop? No. But if he says, yes, I've tried to stop, what was your motivation to quit? According to the KHTWD questionnaire. Okay, and any other medication, blah, blah, blah. Now coming to telling him to stop. Winston, from the chat we have, I'm suspecting your COPD is getting worse. It is and unfortunately, I want you to know, this is the important part, to tell him it is related to your smoking habit. Let's see what he thinks about it. What if the patient says, yes, you're right, doctor. I think I should, or maybe, let's see what he says. Smoking, nobody cares. Okay. I understand what you're saying, but I really love smoking, doctor. So the simulator has already been given these prompts. They know that this is what they're going to do. So this is where your art, you have to try to convince him. See, I understand what you're saying, but I really love smoking, doctor. I completely understand where you're coming from. However, John, we're a little bit concerned. It's because if you continue to smoke, your condition can get worse and it can eventually lead to your lungs completely getting damaged. Okay, I'm not reading this. Make your own dialogues, my love. Okay, if COPD gets worse, you may have problems with breathing, your chronic, and you might need it. Don't, please kindly do not 100, like 80% of the students that fail, they basically say this dialogue as it is. And there is no gap in this. There is like long. There is no like stopping and asking, are you following me? That's why they fail. Okay, you may have chronic cough and breathing difficulty, and you might, okay, doctor, enjoy. I don't want to quit smoking. Oh, and at this point, you are going to bring my important law. What's my important law? Right over here, you're going to tell him, Winston, I am not telling you to quit smoking overnight. This is what you're going to use in cases where cutting it down. I am saying that for now, just reduce it and then slowly reduce it more. And I'm not saying do it over the course of few weeks. No, Winston. How about do it over the year? How does that sound? Maybe this week you can cut down one cigarette and then you go for next month, you cut down another one, and then the month later you can cut down maybe two. And this is the art of counseling, is going telling him that it's going to be a slow game. You don't have to, this is what, see, if even I was addicted to something, someone told me that, honey, you're eating too much junk food, you need to cut it down, and you tell me, I'll be like, bro, I cannot cut it down. And if someone tells me, no, I'm not telling you to cut it, like quit it, just do this month, eat, if you're eating 5 times a month, eat 4 times a month. I'll be like, yeah, that's doable. I can think about that. You get what I'm saying? So I'm looking at psychology. This is how you convince someone. And in my plab too, I had a scenario where I had to convince. And when I did the slow method, the way she was convinced, it was like a full mark station on that. And the lady was just smiling. She's like, yes, doctor, you're right. I'm definitely. And that is what you want. The patient should be smiling and saying, yes, doctor, I think you're right. Okay. So this is slow method. You have to tell them doable things. When you tell someone doable, only then he'll agree, honey. Okay. I just want to tell you how bad smoking is. So this is something, this M guy behind us, that's what he thinks you should do. But I think you should do it like do the reduce, cut down method. Okay. Tell them that this is my biggest hack. I am passing it on to you guys. Okay. Only you guys know this hack. Try to use this. I enjoy smoking because it makes me feel relaxed. I feel good about myself. Oh, I understand that. But see, I know it's a difficult. Take your time, think about it. If patient still refuses, most likely he will not refuse if you use the method that I just taught you. Okay, if he still refuses, you may need oxygen. That means bedridden for most of the time. So you're just telling him, okay, and then you're just going to mention the smoking situation. There's a smoking cessation clinic, nicotine replacement therapy. That's up to you how you want to talk about it. Why is there stuff on my screen? Can I use e-cigarettes? He might ask, can I use e-cigarettes? You can use them with the guidance of smoking cessation. You can benefit from them. They're better than real cigarette, but they're not 100% safe. That's the point you need to remember. So now we come back here. Um, let's talk. That was a lot of information. Now let's organize that information that we just studied. So, Max, what are you going to do first? First, you're going to tell him number one about his COPD. See, I can see, the reason that you're having these recurrent infections is most likely because of this condition of yours. And it's basically when your lungs slowly start deteriorating because of most likely causes the fact that you are smoking. Are you following me, Robert? Yes, doctor. So, Robert, I would highly advise that you consider maybe cutting this down a little bit. How does that sound? Doctor, actually, I love smoking. I can't live without it. Oh, I completely understand where you're coming from, Robert, but I am not telling you to completely quit it. Okay. And I'm not even telling you to even stop doing it like in a matter of weeks. No. I'm saying, how about for this week, just reduce one cigarette. Okay. And then the next month, you can reduce two. And the month following that, you can reduce three. And you can go about it until you will realize that you're starting to get better. So you get what I'm saying at the moment. Do you follow me? Yes, doctor. Okay. So how do you feel about that? Would you be, considering that? I don't know, doctor. I'm not sure. Okay, John, Robert, we also have, I can also refer you, if you're willing, to a smoking cessation clinic. Then you bring up the NHS services. In this clinic, they will help you. So you won't have to really do it alone. They will help you. Okay, so they're going to set a quit date for you. And trust me, it's not going to be like an overnight quitting date. It's most likely going to be the next year. Someday they're going to set it. And according to that, they'll give you medical therapy. They're going to help you do it. They're going to give you insight onto what this habit can cause. Are you following me up to now? Okay. Would you like to know about what medical therapy they're going to give you? Yeah. So there is a nicotine replacement therapy. They put a patch of nicotine on your arm. This gives you that, the craving you have of nicotine from the cigarette. They give it to you in the form of a skin patch. And when you have that, you feel good and it's better for you rather than taking it through cigarette, which causes, has the risk of causing diseases like cancer. Are you following me? Yes, doctor. Okay, and apart from that, I want you to know you're not alone. We have support groups. If you want, I can, refer you to those. You can go to you can meet people similar to you, and that will make you feel a lot better. So you all together, with those people who can relate with you, can help you uh, cut down the habit. Okay, so once again, John, once again, I want you to know we are here for you, and we are here to help you. Just want you to know that it's going to be a slow game. It's going to be, you can use this slogan if you'd like. It's going to be slowly but surely, whatever. Okay, it's going to be a slow game. We are going to be here for you every step of the way. But if you can even cut down one cigarette this month, I'm going to tell you that you have done a brilliant job. Okay, so like become a friend with them. Like, don't hesitate to be friendly. Don't hesitate to be humorous. They like it. UK people love that. They like it if you're being unique. Everyone else is going to come and be like, okay, so what we can do for you, we will refer you to the smoking cessation clinic. Okay, there is a nicotine replacement therapy and everyone's acting robotic and like a doctor. You're not supposed to do that. You're supposed to act like, I love you. I love you, Robert. I love you. Are you hearing me? Okay, so you're going to be like, Robert, I want you to, we're here for you. And I'm not telling you it's not going to happen overnight. Even if you're able to, let's look at it this way. Robert, this month, just leave that one cigarette and come to me. You can call or you can come to the GP and let me know that you cut down one cigarette. And I'm going to be so happy. I'm going to literally give you a standing way, like make it funny. Okay. And just say something unique. Okay. That's how you go for smoking cessation scenario. Okay, before we can go to the obesity scenario, let's go to the most awkward scenario of this entire world. I'm going to be teaching you a scenario that is going to be so awkward, so hard for you to do, more than any sexual history, any different type of history that you have to take. What else was an awkward scenario? We are going to be studying now about counseling case erectile dysfunction. The reason that I decided to take up this case is because it's a difficult case, not because it's difficult, rather because it's awkward as hell. And not just awkward, rather, every notes have given very inappropriate questions to ask. So I've made up some questions that are not going to be too awkward to ask, but they're going to cover everything. Let's talk about erectile dysfunction. A patient will come to you, Robert, again. He'll say, Doctor, I am having issues in bed. Okay. He's going to be embarrassed. First, you have to make him open up. Robert, I want you to know that, we see different types of patients every day. I don't want you to feel embarrassed about anything. No, okay, doctor, I'll tell you. I'm unable to get erect. Okay. So you're going to come to this. Listen to me very carefully. You are going to come to my OG questionnaire, same questionnaire. These are the questions. So whenever erectile dysfunction happens, guys, there could be many different pathways involved. It could be the brain. The brain, and what is that thing you need to assess that his brain is doing fine? So first thing you need to get erect is the brain should have a drive. So sex drive is the first question. You get what I'm saying? Let me just connect my notepad. So the first thing that if he is having trouble with the dysfunction situation, first question you're going to ask him is about his drive. Because that's the first thing that comes in. That's the first thing that will contribute to getting erect, right? The second thing that comes is, are you able to get aroused? Which means, do you have issues starting the erection or maintaining the erection? This is the cycle. Okay, first comes sex drive, then comes the first erection, then comes maintaining the erection, and finally comes the final part, which is ejaculation, right? So just like that, you're going to ask him these questions. Could you rate your sex drive for me from 1 to 5, 1 being the lowest, 5 being the highest? Doctor, it's 5 on 5. So you know the brain is not the problem. Okay, can you tell me, is it the starting of erection? Do you have trouble initiating the erection? Uh, Either he'll say, yes, doctor, it's like I'm unable to get erect. Or either he'll say, no, I'm able to get erect, but I cannot maintain. Okay, it goes down in like, again, in like couple of seconds or something like that. Okay, aroused, are you able to initiate it? And second question, are you able to maintain it? No. And are you able to ejaculate? Doctor, it's hard. It's not easy. No, so I can't. So if this part is messed up, then obviously this part might be messed up too. Okay. So these are the 4 complaint inquiry of erectile dysfunction you need to ask. Same questions. Okay. So sex drive, is it the start that's the problem, or is it the maintenance that's the problem? And are you able to, don't say, are you able to achieve orgasm? That's an awkward question. Just say, are you able to ejaculate? Okay. I mean, it's the same awkward thing, but it's like just, yeah. Okay. So these are the complaint inquiry of erectile dysfunction. Kindly, you will see other notes. You will see more awkward questions. You're going to see very weird questions over there. But honey, don't ask those. Just stay to the point, and this, you don't have much time. Just mention these questions. Okay. And please don't feel embarrassed while asking them. Act like it's completely normal. Okay. Now let's talk about why erectile dysfunction happens. There are some causes. Keep those causes in mind. Number 1, most likely it could be drugs. Drugs as in some people taking beta blockers for hypertension or SSRIs for depression. In those people, they might deal with erectile dysfunction. Some people with long-term medical condition like diabetes mellitus may have trouble with. Sometimes it could be because of smoking, because of alcohol. And sometimes they're just depressed. They are diagnosed with depression. Depression can cause erectile dysfunction. And then finally, it could be him having issues with his partner. That could be the cause. So according to these causes, ask the questions. Okay, so I'm sorry to ask you about this, John. But as a part of the standard question is, are things okay between you and your partner? No, doctor, we're having trouble. Or whatever he says. Okay. Do you have any long-term medical conditions, John? Okay. Are you on any drugs for now? No, doctor. And could you rate your mood for me from 1 to 10? Okay. Do you smoke? Okay. And do you drink alcohol? Okay. Uh, John, could you tell me how are things between you and your partner? I'm sorry to ask that. Doctor, they're not good since this condition or whatever. Okay. So this is how you're going to go about the history of erectile dysfunction. Okay, there's going to be really weird and awkward histories about it, but you're only going to use this and your life is going to be 10, 20 times easier. Okay, then you come to managing it. Managing it is very easy. All you have to do is run some tests according to, just run these tests. Okay, remember these tests. We're going to run some tests, including routine blood tests, your HbA1c because he might have diabetes, your lipid test, like your cholesterol test, and your testosterone. Okay, we're going to run these tests on you just to make sure everything else is okay. But for now, John, I feel like the reason that the reason for your erectile dysfunction could be because you are taking a beta blocker, bisoprolol. Are you following me? Yes, doctor. So what I'm going to do is I'm going to refer you to the cardiologist that gave you this medicine, and he can review your medicine and maybe consider changing it. Are you following me? Yes, doctor. So once he's changed it, then I'll follow you up and most likely your problem should have resolved. Okay, doctor. If it's not beta blocker, it most likely is smoking. So you're going to say it's most likely the cause is smoking. Okay, so I would advise that you consider maybe cutting it down. If you need our help for that, we can also help you. You can, doctor, no, I love smoking. I drink 20 cigarettes a day. If he says all of these, then go to the smoking cessation counseling. Okay. Uh, Other causes, partner. If it's a partner related issue, you go for partners couples therapy. How about I refer you to couples therapy and you both can work through it together. How does that sound? That sounds good. Doctor, could you give me, what do you call that thing? Viagra. Okay, John, I can give you, you can take Viagra. You can take it 1 hour before sex, but don't take Viagra uh, unless you are aroused. Okay, usually when you get aroused, that's when you take it. Safety netting for Viagra is, are you taking any medicine like nitrates, glycerol trinitrate? If he says yes to that, in that case, you have to tell him, kindly take Viagra or just don't give him Viagra in that case. Okay, don't give him Viagra in that case. But this is not a complicated scenario. It's very easy. But the notes, if you go try to see the notes for erectile dysfunction, makes it very hard and awkward. But you're only going to ask these questions. Most
Doctor
likely,
Hassan,
yeah.
if the person is on like GTN, then if we cannot give Viagra, then what we are going to give?
Honey, it's most likely his cause will be beta blocker. We'll tell him that, beta blocker is going to make you feel better. Follow up with us. If it doesn't get better, we can think about what to do next. You get what I'm saying?
Okay, I think we can. I can talk to my senior.
Yeah, you can even talk to your senior.
Yeah.
What you
Okay.
guys need to know is you can run the tests and according to cause, you treat the patient.
All right.
Let's go to, yeah. Let's go to obesity counseling. Okay, obesity counseling case will come like this. So obesity counseling is related to surgery cases, which we're going to discuss on Thursday. However, let's do the obesity counseling situation today because obviously on Thursday there are too many surgery cases. So let's do the counseling today. Okay, so this is your case. FY2 will come in the orthopedic. Lena White, 52-year-old, referred to the orthopedic by GP. She has chronic arthritis of the left knee. Okay. Consultant decided to perform arthroplasty of the left knee, meaning knee replacement surgery. BMI 37. Consultant wants her to lose weight to reach 32. Talk to patient, address concern. Now, before we talk about that, let me tell you the criteria for doing a knee replacement surgery. First criteria is nighttime symptoms. Second criteria is symptom interrupting with daily activities. And third is BMI should be 32. So what was the third symptom? I forgot. I think that was it. So these are the indications for surgery. If a patient is having nighttime symptoms that the pain is causing her, she's unable to sleep in the night. Her symptoms are interrupting her daily activities and her BMI should be less than 32. Only in those cases we can go for knee replacement surgery. That's the indication for knee. So in her case, Lena is 37. The final step we can't give a green signal for the surgery. So that's why Lena needs to lose weight. So this is, you are going to counsel her to lose weight. Got it, guys? So that's the whole art. So who's going to tell me how to do the data gathering in this question? There's so many things going on here. So counseling cases, that's the problem. The counseling cases prompts have so much going on that you're like, oh my God, what do I question on? Let's see. Let's do the underline method. Underline method, go ahead. First thing to underline, what do you need to investigate on?
Her arthritis and the surgery she was planned for.
Well done. So first I'll question her on arthritis related to the indication of a knee replacement surgery. So Arshi, go ahead. Tell me the questions you're going to ask her. Number one.
All right, so could you tell me if you have pain anywhere in your body?
Yes, doctor, actually my knee has been hurting so much.
All right, which knee is it?
Left side.
Okay, and does the pain go anywhere?
No, doctor.
All right, and have you tried anything for it? Perhaps any kind of medication?
No, I take painkillers, but the doctor is saying that I'll go for surgery now, so that's why I've stopped the painkillers.
All right, and tell me, how long has this been going on for?
Doctor, it's been 10 years now. I'm done with the pain. The pain is just too bad for me.
I'm really sorry to hear that. So tell me, how is this affecting your life? Able to get
Well done. Do you see what Arshi did? Arshi did that hack I taught you guys. When someone has been having symptom for more than 2 weeks, always ask impact question, free IPS points. Oh, doctor, it's been affecting my life. I can't sleep at night. And doctor, I cannot do my daily activities. Everything's so difficult, blah, blah, blah.
I see. I'm really sorry to hear that.
So pause over here. So Arshi has asked like, perfect questions for that's enough to ask about chronic arthritis. I try to teach you guys not to overextend the questions. These are enough. You did the impact part. You asked her about the complaint inquiry. Just don't forget your red flags. Okay, what are the red flag in arthritis?
All right, so have you noticed any kind of fever?
Very good.
Any
No.
chills? Any tenderness or redness around your knee joint?
Well done. That's amazing. Who's going to tell me why Arshi asked about fever? How is that a red flag?
Septic arthritis.
Well done. Guys, remember, septic arthritis is deadly. Sepsis, it causes sepsis. That's why it's a red flag situation. Whenever someone comes with septic arthritis, meaning arthritis causing fever, drowsiness, sickness, it basically means he's going into sepsis, admit him. It's a red flag. Just like PID, if pelvic inflammatory disease is causing fever, drowsiness, tiredness, high grade fever, it's probably sepsis. Okay, anyway. So now you've assessed her about arthritis. Let's go to the next part. All right, could you tell me what the consultant told you? Yes, doctor, he said that there will be surgery done for me. Okay, and did he tell you anything more than that? So basically, you want to assess, does she know about that her BMI is high, or did the orthopedic just leave it to the GP to tell her that? Okay, she probably will not know. She probably will not know. Okay, she'll say, no, doctor, he just sent me to you. So you're like, bro, that orthopedic is a smart man. He wanted me to do the dirty part. Okay. So you're going to ask her the cause. What is the next thing you need to assess her on? Her weight. How did her weight get that high? Okay. So what do you think? What are the questions you can ask related to weight? So first thing you asked was arthritis. Next thing you asked about the arthroplasty. What's the third thing? The weight part. What are the questions related to weight?
Any long-term medical condition?
Very good. Very good. So PMAF, TOSA, P. What else could be the reason for a high weight, whatever?
Any regular medications?
Medication, like which medication can cause weight gain? Well done. Steroids can cause weight gain. Moon face. That's what we called it, right? Something like that.
And then
Okay.
occupation also, if she does not get time to exercise and stuff, if it's like a
So
desk.
that's not occupation, that's a DESA. Okay. So E, how often do you exercise? Could you walk me through your diet? What other causes can be for weight gain?
He's eating too much.
Diet asked, exercise asked. What else? You can ask her PCOD. You can ask her hypothyroidism.
That
Okay.
comes under long-term medical condition, right?
Yeah. Okay. Or during the complaint inquiry also, you could have asked, Did you notice how are your periods? Is everything okay? And are they irregular? No, doctor. Have you noticed any, what do you call it? Cold when other people feel hot? No, doctor. All right. So what if it's like a incidental diagnosis, not a long-term medical condition in that case? Okay, just to show off to the examiner. However, listen to me, guys. If you weren't able to ask hypothyroid PCO, it doesn't mean you're going to fail. Okay. Most important, did you ask the red flags? Did you talk to her about the knee surgery and tell her to lose weight? Yes, I did. You passed the station. That's it. Okay, but just remember, these are some important pointers related to losing the weight. Now coming to the management part. Let's do the counseling. Thank you so much for talking to me. So Marissa, let me explain it to you. Um, as you know, the orthopedic had planned surgery for you because it's an indication for you to get surgery as your, pain is interrupting with your sleep. It's interrupting with your day-to-day activities. I know that can be very difficult. However, Marissa, I have been advised by the surgeon that he cannot proceed with the surgery yet. It's because your height to weight ratio is more than required for the surgery. Are you following me? No, doctor. What do you mean? Let me explain it to you. So, your BMI, which is height to weight ratio, how much weight should be in your height, is more. Are you following me? It's 37. This comes in the category of obese. Are you following me? That's how nicely, that's a good way of saying obese. Don't just say you are obese, you are fat. Okay, don't say that. So it is 37. Normal BMI should be 18 to 25. Are you following me up to now? Yes, doctor. Now see, for the surgery to happen, Marissa, your BMI should come down to at least 32 for us to be able to proceed with the surgery. Doctor, why? Why, doctor? Oh, well, see, Marissa, even if we were to, doctor, can you just proceed with the surgery? It's okay, I don't mind. So what you're going to tell her is this. Even if we were to proceed with the surgery with your BMI, since knee is a weight-bearing joint, there are chances for your surgery to fail because when you try to stand up, the weight of your body can cause your surgery to fail. The moment you say it will fail, that's the moment she'll agree to you. Why? Because if you tell me that I'll fail if I did this, I will 100% be like, okay, then I don't want to do it. You get what I'm saying? Like, why go through the pain if it's going to fail, right? So that's a very good way of convincing her at this point. Okay. She'll be like, okay, I guess, doctor, you are right. But how can I lose weight, doctor? It's so hard for me to lose weight. Okay, Marissa, have you tried to do it before? Doctor, I did, but I'm unable to eat. Okay, listen to me. Marissa, listen. Anything is possible. Coming to the art of counseling, art of convincing has started. Okay, let's do this together. Okay, Marissa, I am with you. Okay, first, I am going to let me give you the good news. You don't need to do it very quickly. We can do it slowly. Okay, how does that sound? Okay, that sounds good. How about I refer you to a dietitian and I ask the dietitian to make you an easy plan that it starts with cutting down food slowly and then more properly. Are you following me? Yes, doctor. How about add on some exercise? How about Marissa from tomorrow on just do 15 minutes walk? That's it. That's all I ask. Okay? And maybe next month you can start doing 30-minute walk. And the month next to it you can do 1 hour walk. How does that sound? Okay, doctor. I think that sounds doable. Okay? And follow the dietitian's plan. Combine these two together and I assure you, Marissa, before you know it, your BMI will go down. Does that make sense? Yeah, doctor, I guess. But I want you to know, Marissa, that this pain can only go after that surgery, and you should be motivated for that surgery. And that motivation itself should lead you to lose the weight. Yes, doctor, you're right. So get it? So it's all about your own words. I'm not everything I've said right now, I made it up right now. So please try to have some words of yourself. Please don't copy notes. Make up your own words. Try to convince the person. You're a salesman in counseling. Okay, so how can the best psychological method of convincing someone to break the habit is do it slowly, do it easy, do doable things. How about Marissa, this month you cut down you stop eating fast food about, okay, for instance, how many times is she eating? Doctor, I eat junk 3 times a week. How about do 2 times a week this month? And then next month, 1 time a week. How does that sound? And then you slowly taper it down. Okay, doctor. These are just extra things just for your information, guys. If she is 35 BMI, you can start her on a medication called Orlistat. So in this case, I can totally give her Orlistat. So if you'd like, and I will also start you on a medication called Orlistat. This will also help you. But remember, Marissa, don't rely just on medicine. Medicine cannot do you any good if you're not working hard with it. Are you following me? Yes, doctor. Okay. If it's more than 35, you go for semaglutide. If it's, I just want you guys to know that even if you don't say the medication method, it's totally fine. You won't fail. You should just be able to convince her. This entire case, the examiner is looking, is my candidate able to convince the patient? How beautifully is she convincing? Okay, if she's able to convince, even if you didn't mention Orlistat and that crap, it's okay. Rather, it's better that you convince her to do it by lifestyle modifications other than, bringing up the medicine part. So he will be happy if you're able to do that. Okay, so this is obesity. So would anybody like to try obesity counseling? In your own words. Aisha's having thoughts, second thoughts. Aisha unmutes and then mutes.
Okay.
Go ahead.
All right. The patient's name is Marisa.
Sorry, Lena. Okay, Lena.
Okay. Thank you so much, Lena, for talking to me. And we had our assessments, and as you are planned for the surgery for the knee replacement, but we cannot proceed with that. You know why?
Why, doctor?
Because your BMI, that is height to weight ratio, that does not come in the range that we can proceed with the operation. The normal weight BMI is 18 to 25, and the for surgery to proceed, it is less than 32. Okay, are you following me?
But doctor, why? Why does it have to be 32? Can you just do the surgery with me? I can't lose weight right now.
Oh, I understand where you are coming from. But let me tell you, even we proceed with the operation, it will not be beneficial for you because of your weight, okay? Because, this is a weight-bearing joint and the surgery can fail. Am I making sense so far?
How can the surgery fail?
It's it's a weight-bearing joint, and the knee won't be able to take this much weight, okay? So if we will do the surgery, it will not be successful. All right.
Okay. I
Okay.
get it, doctor, but how do I explain it to you? I have tried to lose weight in the past, but it's so impossible. I've tried,
Yeah, I
cutting junk
understand.
and stuff. It's just
Okay.
very difficult for me.
Okay, just don't worry. We are going to sort it out together. Okay.
Okay.
So, what you have tried before?
Before,
What
doctor,
might?
I tried going to the gym for an
Oh,
hour.
okay.
Too
Okay.
much. I'd go to the gym for 2 days and I was like, this is too much. I would die. Everyone would be so
Mhm.
natural at it and I was just dying. So I just stopped doing
Okay.
it.
Okay, just don't worry. We are going to sort it out together. There are many things which will help you to reduce your weight. Okay, let me explain that to you. Okay. Um, what about that? We are going to do it gradually. Let's start with your diet. Every you should. I will refer you to the dietitian, and they will make a diet plan for you, and they will help you that how can you do it gradually. Okay. And since you are doing the exercise, so that's very good. And when we pair up these things, I would suggest that we can do even exercise, start from gradually from 15 minutes, 30 minutes, but stick together with the plan, both the diet and the exercise. And in this way, you will be able to reduce the weight. Okay.
Okay.
All right. So um, if, anything else you are concerned for?
No, doctor. I can try.
Okay, that's great. So let's go through these things, and I hope hopefully you will be able to be successful, and then we will proceeding with the surgery. Okay, thank you very much.
Okay, well done, Aisha. So, Aisha, the thing is that, guys, always remember, the more you practice, the better you will get at it. Okay, in the beginning, obviously, it's not going to be the easiest. It is kind of difficult to convince. Not everyone, it's not easy, but the fact that Aisha is trying, just look at how she's improving. So, this will improve you. So, always remember, practice is everything. So, remember these 3 points for whenever it comes to convincing someone, we're going to do it together. That's a very beautiful point. Like, that makes a person feel good. Okay, and second thing is, we will do it slow. You always give her some tiny goal, like how about this month you stop like one meal, that's it, or just this month just do 15-minute walk, that's it, that's all I ask you. How does that sound? Yes or no? See, you went to the gym, you went for an hour and you were around people who were already doing that gym for years, right? So don't compare yourself with them. You do you. For you at the moment, it's best you start slow. 15 minutes is enough for you at the moment. Okay, doctor, that sounds doable. Okay, that's when she'll like what you said. Okay, and I'm going to refer you to dietitian, and I'm going to write it down to the dietitian, make you an easy plan. Like it starts easy and then it gets to not difficult, but obviously it gets intenser. Is intenser even a word? Moving on. So, guys, you get it? Does anybody else want to try it? And Aisha, this time, also try to not keep speaking, keep asking, are you following me? Are you following me? That makes it more interesting.
Okay.
Oh, wow, I just realized we're done with counseling. Perfect. So, so always remember, guys, the take home points, lol. The take home points of counseling are keep the history damn short if you can, if it's possible. Okay, I know that some cases like learning disability, there are actually quite a lot of history and a lot of management, but try to keep it short wherever you can. Try not to go into what, do you have any allergies? Like, why? Why? Like, what the heck? Okay, and then keep the management long, but make sure whenever, guys, counseling, one thing everyone complains of is getting disorganized, because it's like, where do I start the management from? always start always start from basics. What is DVT? What is surgery? What is an arthroplasty? You know what I'm saying? Like, keep it, always start from basics and then lead up to the results, what they are showing, and then come to the counseling that, honey, you need to stop killing yourself and, blah, blah, blah. So it's not really difficult and it's not really easy. If you're a good salesman, it's going to be piece of cake for you to do. But if you're not good at it, honey, practice, practice, practice. Okay. Would anybody want to practice right now? One last chance I'm giving you guys before we go. Because see, you should see the progress of Aisha through the what do you call it? Through the journey of these classes. Okay. One more thing, I think Dr. Azram should have taught you the unreasonable request cases. Okay. If he hasn't taught you, he might have probably, I don't know when he's going to teach it, but he's going to teach you the unreasonable requests. These are also part of counseling. So I feel like I am answerable for them. So just remember one thing, sometimes a patient will come to you and she will say, doctor, I want leave. Can you give me a sick note? You have to say, no, honey, I cannot give you a sick note, my love. Why do you want a leave? Doctor, actually, I have kids at home. So just remember as rule that there is a whole thing in NHS, that there is a whole rule that and if you can talk to the local council, as you get for 2-year-old children, you get about 15 hours of childcare free, and for 3-year-olds, you get 30 hours of childcare free. So how about look into that? If she says no, doctor, no, and it's an employment related issue, citizen advisory bureau. Simple as that. Okay, so remember these councils, these bureaus, these services. Okay, now let's go to the brainstorming time. Guys, I want to leave alcohol. What is the service in NHS for that? Sorry. Yeah. So, guys, I want to leave alcohol. I am trying to get rid of my alcohol habit.
Addiction, rehabilitation, something.
Okay, it's addiction rehabilitation, ARTTT, and treatment center, ARTC. Honey, memorize these right now. Why don't you guys remember this? Uh, actually, doctor, I have an unplanned pregnancy. I don't know what to do about my pregnancy. I'm only 15 years old.
No
What
part.
do you want?
New pass,
Well,
National Unplanned Pregnancy Advisory Service.
well done. Doctor, actually, the problem is that, actually, doctor, my problem is that I want to leave my job, but the problem is that, because it works at heights and I have epilepsy, I want to leave the job. What do I do?
Citizen advisory.
Well done. Citizen Advisory Bureau. Whenever it's job related issue, Citizen Advisory Bureau. Whenever it's unplanned pregnancy, it's this. Okay. Doctor, I am schizophrenic, but I don't want to come to the hospital.
Crisis resolution home treatment.
Well done. And doctor, actually, the problem is that I want to go to doctor, I want childcare, but I don't know how to arrange that. Actually, doctor, I want to change my counselor.
HCPC.
Well done. My counselor got physical with me. I am going to report him to Health Care and Protection Council. Okay. Doctor, actually, my child had a spiral fracture.
Social services safeguarding team.
Very good, Arshi. That was a tricky question. Doctor, actually, the problem is that I have bulimia.
Eating disorder unit.
What did I teach you guys about bulimia?
Self-help program, I think.
Well done. Okay, guys, please remember this from now on. This is actually a mistake that 200 people who give me mocks, they make. They always say eating disorder unit for bulimia. But remember, bulimia is not an eating disorder unit because bulimia is still resolvable with simple self-help programs because it's not as malignant as anorexia. Anorexia is a more eating disorder unit type of a case because you're still like living and breathing. Okay, doctor, I am doing heroin abuse. Please help me leave heroin abuse. What do I do?
I think ARTC only.
Exactly, well done. Same place. Addiction Rehabilitation Treatment Center. Okay. Doctor, actually, I'm smoking a lot. So yeah, like what am I supposed to do? What are you gonna refer me to?
Smoking cessation.
Well done. Smoking cessation clinic. Actually, doctor, the problem is that um my child is not speaking and he's not making eye contact with me. He's 2 years old.
To pediatrics.
Refer him to the multidisciplinary team for autism, okay? That's it. Okay, doctor, I keep falling down. I'm a 60-year-old lady. I keep falling down 20 times. 2,000 times I fell down. And usually I fall down at my home. What would you like to refer from me?
Occupational therapist.
Occupational health. Okay. So occupational health is for home, therapist is for job, work. So at work, if I'm saying, doctor, actually my chair is too broken and my back is gonna break or whatever, then it's occupational therapist. Actually, doctor, the problem over here is that, doctor, the problem is I forgot what other things do we have. Doctor, actually, I want to get pregnant. I have endometriosis and I want to get pregnant. What do you want to refer me to?
Fertility clinic.
Well done. So guys, this is how everything should be on your fingertips like that. Like you should know the management instantly. And oh yeah. So doctor, actually someone raped my friend. Okay, I don't want to say myself. Where are you gonna send me? Sorry, so not me, like my friend.
Sark, sexual assault,
Well done, Sark.
rehabilitation.
So if Arshi was able to say all of this, if you guys have come this far, you were able to say all of this. Some introverts could say all of this, but just they didn't want to open their mic. Honey, you have learned a lot in my lectures. You've learned a lot. You've come very far in your prep. Well done. Even like the bare minimum, if you could know, that's amazing. So our next class is on Thursday. We're gonna do the surgery cases, and that'll be our last class. And last class obviously will come with a quiz, and then we're gonna decide our top student of the entire courses. Well done, guys, for coming this far. Love you all, and do your counseling today and see how well you do. Keep practicing. If you have any questions, you can always ask me. Goodbye.
Well, I already know the top student.
No, 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 no. Sehed, the tomorrow's quiz will also determine who is going to be, okay? So quiz has a very important role in it.
Okay.
Okay. So it's not
Yeah.
predictable. No, nothing's predictable with me. Thank you, sir, for always making me laugh.
No, no.
Okay, bye guys. Have a good day.
All right. Bye-bye.